Hey, Joe, welcome to this next episode of the three healthcare headlines you need to know from Tallahassee. I'm excited to be with you today, Joe, for a number of reasons. One of them is, this is the first week of legislative session, so we have a lot to talk about. But also, I guess we should warn the audience. We're at a conference for the Florida Society of Nephrology down in West Palm Beach. So we might be a little punchy. It's been some long days and nights as we're pulling off this event. So just a word of warning to the audience, we are a bit punchy today, but looking forward to delivering you guys the healthcare headlines you need to know. I'm Fraser Cobbe. I'm the director of multiple medical associations here in the state of Florida, and my colleague is Joe, and he'll introduce himself.
Yeah, and I'm Joe Daraskevich. I work alongside Fraser. We are here in West Palm Beach. Like Fraser said, we've had some long days, but they've been fun days, a lot of good speakers, and a lot of good socials. We've had some good receptions, and just good to see a lot of the doctors in person. So we're down here in West Palm Beach, but let's cover what's been happening up there in Tallahassee. Fraser, you ready to jump right in?
Yep, and we should say thanks to the nephrologist for actually getting us both to wear a tie on the same podcast. You're looking great, buddy. Looking forward to this.
Thank you. Yep. Cool. All right. Well, as we do each week during the legislative session, we kind of recap some things that happen over there, but we're breaking it down with three headlines. So hopefully it makes sense if you're a first-time viewer, first-time listener. We hope you'll come back. We're going to do this all through session and leave comments in the comment section, and we'll let you know what you need to know. So let's jump right in, Fraser. First headline of the 2026 session. Uh, you should always crawl before you run. The Florida legislature says, hold my beer. What do you think about
Yeah, sorry. I told you it'd be a little punchy today.
that? Yeah.
Yeah, the Florida legislature officially started this week and they wasted no time diving right in. So they're like, let's get our priority stuff off the plate right away. And we saw action on priorities almost immediately. So sometimes sessions kind of take a little bit of time to ramp up to speed, but not this year. I guess there's some unfinished business from last year, and it is an election year too. So I think folks want to get their priorities pushed forward and really try and get their work done and get out of Tallahassee, hopefully on time this year and out onto the campaign trail. A lot of the dynamics we talked about last session have not changed. We still have a House and Senate and governor that aren't totally all on the same page. They have different priorities, and that's become evident already. If you talk to the Senate president, he has his one priority, the Rural Renaissance Bill, and he passed that out the first week of session. So one thing for our healthcare audience to mention on that, last year it did have some healthcare components, but this year that Rural Renaissance Bill does not really have any healthcare at all, primarily because the state of Florida got a federal grant for transforming rural healthcare, $209 million from the feds that are coming down. So the legislature is going to give the regulatory agencies the opportunity to implement some ideas around transforming, healthcare delivery in a rural setting. Now, that's on the Senate side. Over on the House side, the Speaker has quite a few priorities. So there's probably six on a laundry list of things he would love to get done this year. So again, give you an idea of, you got a laser focus approach on one chamber. The House has a number of things that they really want to get done this year. And to throw into the mix, it is an election year, and we have a governor election this year as well. So there's a lot on the line from a political standpoint this year, and so a lot of that drama will unfold here in the next couple months of session in Tallahassee. So we are just a bit along for the ride in some instances, but doing what we can to definitely advocate on behalf of our patients and our doctors.
Yeah, and I'm glad you brought up last year's session, how it just seemed like it kept going and going and got extended and everything. And some things that we thought would become priorities toward the end of session sort of fell off and, didn't get done. So it kind of makes sense that they're hitting the ground running and they're getting some stuff off their plate immediately. And obviously the priorities are becoming more and more clear as we get into the nitty gritty here. So
Yeah.
yeah, buckle up, everybody. Yeah, go ahead, Fraser.
And especially if he's got five or six priorities, I'm talking about he, the Speaker of the House, which one is his real priority when it comes down to horse trading at the end of session? We kind of had an idea he wants to deal with, property taxes. He wants to deal with his frontier healthcare, big, beautiful healthcare frontier bill. He's got the wrongful death bill, which we'll talk about in a second. So he's got a lot of stuff over there. It's like, which one's his real priority? How does the horse trading play out over the coming months? So it's going to be a interesting time up there for sure.
Yeah, with those really, big bills, a lot can change, a lot can happen. So we'll keep our finger on the pulse, and every week we do these, so we'll let everybody know with any updates throughout. Go ahead. You got another point?
Yeah, the only other thing I mentioned as far as what may, cloud over session is the budget. So they do need to figure out how to cut the budget by about $1 billion. I think I'm right at $1 billion, just because a lot of the COVID emergency money from the feds has gone away now. So while the state of Florida has to have a balanced budget, they're getting less revenue down from that pandemic emergency. So they have to figure out how to trim the budget to make sure they can balance that by the end of the day, by the end of the session. So.
Gonna be exciting. We got a lot to get to. So speaking of get to things, you ready to move on to the second headline today?
Yep.
All right, so Fraser, the second headline this week, we're still in January, but we're kind of looking ahead to things. So Groundhog Day comes early. Florida House passes wrongful death repeal. It's not quite Groundhog Day, but I get what you're saying. It's that familiar feeling, I guess.
Yeah,
What do you mean by
definitely.
that?
A bit of deja vu here. We've been talking about the wrongful death repeal bill for a number of years now. If you'll recall, in the 2025 legislative session, the House and Senate both passed this legislation by a very wide margin and sent it to the governor. We had concerns with that legislation. We still do have concerns with that bill now. Last year, the governor did veto the legislation, and in his veto message, he was concerned that there was no caps on damages to mitigate some of the impacts on med mal premiums if a clean repeal bill did pass. So we knew the House was intent on passing this bill again. They've been moving it through the committee process leading up to session, and we actually prognosticated a bit last week that it would probably pass the first week of session, and it actually did. So it passed this week by another wide margin, but interestingly, not as wide a margin as last year. So that might be a little bit because it's an election year. It may be folks that are uncertain if the bill is going to move over on the Senate side. So why take a difficult vote now on something that may not pass, and the governor may actually still veto it again next year. So last year it had 6 no votes. On the bill this year that passed the House. This week there was 17 no votes, so quite a jump in legislators voting no on it. There was also 12 that did not vote on the bill for whatever reason they would have. They weren't there or whatever, didn't want to cast a vote on this one. So anyway, a little bit more education we've done in those months with a few more people that are cautious about passing a clean repeal bill. We'll monitor this. Also, last podcast we recorded, there was not a Senate bill filed as of yet, but there has been a bill filed in that chamber now. Senator Grawl has filed that bill. So there's a vehicle over on the Senate side. We'll just have to watch and see if it actually gets any momentum, gets any hearings. It's been referred to 3 committees, and we'll kind of watch that over on that chamber. Again, we continue to oppose a clean repeal bill. If the bill is going to pass, we want to make sure it has caps on damages. Again, to make sure as you add all these additional litigants to the pool, that there's some measure that's going to make sure that healthcare is accessible to everybody, and we don't just crank up the premiums on med mal. So we will keep you posted and see what happens now over on the Senate side, since the House is throwing that ball over, and we'll see what happens when it's received over on the Senate.
It's a case of here we go again. And for people who might be new to advocacy and new to kind of this arena, it is a very interesting topic. And then for the people who have been, going over to Tallahassee and talking to state reps and state senators, this is something that, yeah, we've been talking about for a long time and keeping an eye on very closely. Obviously, very something that affects a lot of people across the state. So more to come on that, I would say, right? We'll have a lot of development over the next weeks to come.
Absolutely.
All right, ready for the third one?
Yep.
All right, we'll close this one out with a pretty big one. Payers behaving badly. Have Floridians had enough? What do you think? Is enough enough?
We're hoping so. I know that our physician members have had enough of insurance carrier games over the years and decades here. And again, that educational process you mentioned on question number 2, that is ongoing, and it's important we continue to engage and educate them on the issues we're seeing on the ground with payers. It's always difficult to pass any legislation that's going to impact any part of the insurance industry, and healthcare for sure is some of the toughest bills to pass. But there are pieces of legislation that have been filed this year to address down coding, prior authorization, retroactive denials, the use of humans when a carrier is using AI to deny claims. We want to have some human intervention there. So there's quite a few things that are teed up where members of the legislature are understanding. They're hearing our voices. They understand it. You're getting more and more patients that are being impacted by prior authorization delays and treatment and everything. So the general awareness is continues to grow as more legislators have neighbors, friends, constituents that are impacted by this stuff. Again, that's what we need is that education to continue. So Senator Ralph Masulo, interesting study, is a physician over on the west coast of Florida. He just got reelected to the Senate in a special election. He had term limited out, so had left Tallahassee. So now he's back in the Florida Senate. Again, a physician, he understands this firsthand. So he's filed two bills that would deal with some of the bad insurer behavior over on the Senate side. We've got vehicles on the House that mirror them. So we are hoping to get some momentum on those bills this year too. So again, as you always preach, Joe, we need our physicians reaching out to their legislators saying these issues matter to my patients, they matter to me in my practice. Here's some mechanisms for you to help and make sure that treatment is rendered timely uh, to
Yeah.
to our folks. Yeah.
And it's good to have that position in Tallahassee. Obviously we talk about so often that many of these legislators don't really know what it's like to be in the shoes of a doctor, but having someone who does know that is extremely important. So I'm not encouraging anyone in particular to go run for office or anything like that, but it is great to know that we have at least one ally over there that knows what it feels like to be a doctor. So very good that he's back over in that role.
Yeah, and we definitely encourage doctors to think about it if they've got the means and a desire to do so. Certainly, having more physician voices walk in the halls, being up there as laws are made, is really important. So, definitely kudos to Senator Masulo, and hopefully, we'll get some momentum on these good bills.
Yep, I agree. And yeah, it would be fun. It would be fun to watch some more doctors run for office, and we'd be happy to advocate for things like that happening. So anyway, any last thoughts on that one before we move on, Fraser?
No, there was a lot happening for a first week of session. Oftentimes it's just pomp and circumstance, but there's substance as well as circumstance this week. So it was fantastic that we're off to a running start and looking forward to bringing you guys the headlines every week here for the next couple months.
Yep. And I, as I usually do, you ready for a musical selection?
I think we're ready.
All right, well, so this one is this was my favorite band back in like 2004 to 2008-ish. So they've been around a while, but they're still not mainstream by any means. So that's why I told you earlier I'd throw these guys out there to hopefully get some new fans. The band's name is Umphreys McGee, and it's spelled with a U. The first letter of that is a U. So Umphreys McGee, and the song that I'm picking is one of their hits, if you can call them hits, in the kitchen. And so my thought is, these legislators are over there cooking. They're doing, they're putting the ingredients together, and they're making the sauce as we speak right now. So it's a good song. It's a catchy song. But as you get more into Humphreys McGee, they do all kind, like they're a great live band. They like to do cover songs, and they like to actually mash up different songs and play them at the same time and everything. But In the Kitchen is one of their originals that I think everyone will really enjoy. So Humphreys McGee, spelled with a U, and the song is In the Kitchen.
Fantastic. I love it. I do like too the glance back into your life. We'll see how Joe was back in the early 2000s, right? What was going on
Yeah.
in his life at that time. So I love the recommendation, Joe, and this has been a lot of fun again. And again, look forward to doing the same thing next week.
Yep. We'll see everybody next time.
Take care.